Welcome to my channel, Catalyst Midwife Academy, where we ignite understanding and make learning easier. In our today's class, we will be talking about the overview of thoracic wall. As we all know, thorax is one of the important regions in our body, in the sense that it serves as a protection to very vital visceral organs such as the lung and the heart. So, the thoracic wall is being formed posteriorly by vertebral column, that's thoracic vertebra, formed anteriorly by the sternum with their costal cartilage, and laterally by the ribs together with their intercostal spaces. Those are the formation or the boundaries of the thoracic wall. We said posteriorly, thoracic wall is formed by thoracic vertebra. Anteriorly, it is formed by the sternum and costal cartilage. Laterally, it is formed by 12 pairs of ribs with their intercostal space. These are the formation of the thoracic wall. It is formed posteriorly by the thoracic wall, the thoracic, that is vertebra, thoracic vertebra, anteriorly by the sternum and the costal cartilage, and laterally it is being formed by ribs. Now, the coverings of the thoracic wall. The thoracic wall is covered from superficial to the deep by the skin, the superficial fascia, the deep fascia, and the muscles. These are the coverings of the thoracic wall. The skin, we should know that the skin of the anterior region is thinner compared to the skin at the posterior region of the thoracic wall. And the cutaneous innervation, that is innervation to the skin, cutaneous innervation to the skin of the thorax is provided by supraclavicular nerve, C4. This supraclavicular nerve is one that supplies the skin of the thorax from the sternal angle above, whereby from the sternal angle below it is supplied by the anterior primary lamin of T2 to T6 thoracic nerves. Now we say that the skin of the thorax, the cutaneous innervation of the skin of the thorax is divided into the two aspects by the sternal angle. We know that the sternal angle is located at the second ribs and in between the T4 and the T5. Now, above the sternal angle, the skin of the thorax is supplied by the supraclavicular nerve, whereby below the sternal angle is supplied by the anterior primary lamin of T2 to T6 of the thoracic nerve. Now, the superficial fascia. The superficial fascia is very thick at the posterior region so that it can withstand the pressure while lying in the supine position. And one of the important contents of this superficial fascia is the mammary gland. Mammary gland is one of the important structure or one of the important organs that is located in the superficial fascia of the thoracic wall. Now, the deep fascia The deep fascia is always thin or ill-defined unless in the pectoral region where it permits the movement of the thorax during breathing. Now, for the muscles of the thorax are majorly divided into the two. There are extrinsic muscles and the intrinsic muscles. The extrinsic muscles and the intrinsic muscles. The extrinsic muscles of the thoracic wall are the muscles that are not confined in the thoracic region, but they are coming from other regions, such as the muscles of upper limb, the muscles of the back, the muscles of abdomen. Example of the muscles of the abdomen that we can see in the thorax are pectoralis major. We can also see serratus anterior. Now, the example of the muscles of the back that we can see is that we can see trapezius. We can see rhomboid major and minor. Rhomboid major and minor. We can see latissimus dorsi. However, the muscles of the abdomen in which we can see in the thoracic wall region, they include, there is rectus abdominalis and the rest. So these muscles, they are the ones that form the extrinsic muscles of the thoracic wall. They are not confined in the thoracic region, though they are coming from other parts of the body. Now, the intrinsic muscles of the thorax, they are arranged in 3 layers. And this 3-layer arrangement, they are usually incomparable to the arrangement of the muscles in the abdomen, in the anterior abdominal wall. Now, the intrinsic muscles of the thorax, as we said, that they are arranged in 3 layers. There are superficial layer, intermediate layer, and deep layer. Intrinsic muscles are the superficial layer. The superficial layer is also called external intercostal muscle. The intermediate layer is called internal intercostal muscle, whereas the deep layer is called transversus thoracis. Now, these are the intrinsic muscles of the thoracic wall. Now, we have to look at each muscle, their extent, their origin, their insertion, nerve supply, as well as their function. The intrinsic muscles of the thoracic wall, we say they are external intercostal muscle and the internal intercostal muscles. Now, we have to compare them because they have short differences that is related to them. Firstly, we should know their extent. Now, their extent. The external intercostal muscle extends within the intercostal space, and it extends from the tubercle of the ribs behind into the costochondral junction anteriorly, where it will be placed by anterior intercostal membrane. So the external intercostal muscle, it continues anteriorly or is replaced anteriorly by anterior intercostal membrane. Whereby the internal intercostal muscle, it extends within the wall of the sternum into the neck of the ribs behind, and it is replaced by the posterior intercostal membrane. So the internal intercostal muscle continues posteriorly by posterior intercostal membrane. This is about their extent. Now, moving forward to their origin and their insertion. Moving forward for their origin, the external intercostal muscle originated from the lower border of the ribs above. It originated from lower border of the rib above and inserted into the outer lip of the upper border of the rib below. Upper border of the rib below. That is, it is originated from the lower border of the rib above and inserted into the outer lip of the upper border of the rib below. Whereas the internal intercostal muscle, it originated from the floor of costal groove of the lower border of rib above and then inserted into the inner lip of the rib below. This is one of their differences. The external intercostal muscle inserted into the outer lip of the rib below, whereby the internal intercostal muscle inserted into the inner lip of the rib below. Now we should talk about the directions of their fibers. Directions of their fibers. Directions of their fibers. External intercostal muscle, the fiber of it is directed forward, downward, and medially, except in its posterior aspect, whereby its fibers is directed laterally. So there is an exception in external intercostal muscle. Posteriorly, its fibers directed laterally. That is in the posterior aspect of it. Whereby the fibers of internal intercostal muscles, the fibers of it is directed forward, upward, and medially at right angle to those of the external intercostal muscles. Now, their nerve supply nerve supply. External intercostal muscle and internal intercostal muscle, they are both supplied by intercostal nerves. Intercostal nerves of corresponding space. So they are being supplied by the intercostal nerves of their corresponding spaces. Up next is function. The function of the external intercostal wall muscle is that it helps to elevate ribs. It helps to elevate ribs during inhalation, whereby the internal intercostal wall muscle helps to elevate ribs during exhalation. Now this is the comparison between the external intercostal muscle and the internal intercostal muscle. We saw that there are also deep muscle again, which is called transversus. Another deep muscle, which is called transversus thorax. The transversus thorax, its direction of the fiber is the same thing as that of the internal intercostal muscle, that is directed forward, upward, and medially. Now, as you can see here, this diagram here is showing us the muscles. This green color here is this anterior intercostal membrane and this posterior intercostal membrane. Now we say that the external intercostal muscle is being replaced anteriorly by the anterior intercostal membrane. So these are our external intercostal muscles. As well as the posterior intercostal membrane is the one that replaces the internal intercostal muscles. So these are our internal intercostal muscles. So because its origin is going backward, the internal intercostal muscle, and it is being replaced by posterior intercostal membrane, whereby the external intercostal muscle is replaced anteriorly by anterior intercostal membrane. Now these the directions of their fibers. These ribs, this another rib, this intercostalis intimus. This intercostalis intimus is one of the muscles that forms thoracic intimus, because thoracic intimus muscle is made formed by three muscles. One is intercostalis intimus, second one is subcostalis, and the last one is sternocostalis. Now this muscle here is our internal intercostal muscle, in the sense that the internal intercostal muscles, we say the direction of the fiber, that they are directed upward. They are directed upward. While by this external intercostal muscle, their fibers is being directed downward and medially. As you can see, this internal intercostal muscle is in right angle to the external intercostal muscles. The intercostal space, all these spaces here is our intercostal space. This is our vein, the artery, and the nerve. And again, we should also know that neurovascular structures, they are located between the intermediate layer and the deep layer. That is, like they call that layer a neurovascular plane, and it's located between the internal intercostal muscle and thoracic transversus. So between this layer of this muscle, that is where the neurovascular plane is located. So we should take note of that. So this is just an overview of the thoracic wall. Please, if you enjoy this class, kindly subscribe, like, comment, and share. Meet me in part 2, where we'll be dissecting intercostal spaces. Thanks.